Hi everyone, welcome back to my YouTube channel, and today we are going to talk about auditory ossicles. So let's start our topic with introduction. Auditory ossicles are three smallest bones in human body that are located in the middle ear. They form a chain that transmits and amplifies sound vibration from tympanic membrane to the oval window of inner ear. These bones are essential for efficient hearing as they convert sound waves into air into mechanical energy that travels through the fluid-filled inner ear. Location: they are found in tympanic cavity of middle ear. They are suspended by ligaments and connected to each other by tiny synovial joints. Auditory ossicles span the gap between tympanic membrane laterally and oval window medially. General features of auditory ossicles: there are three bones paired on one, so three bones are on one ear and three bones are in other ear. They are smallest bones of body and stape is the smallest of them. Their function is to conduct sound vibration from the external ear to the inner ear with mechanical advantage. Each bone is joined by synovial joint that allow delicate movement of these bones. Auditory ossicles include malleus, that is also called as hammer, incus, that is also called as anvil, and stape, that is also called as stirrup. First is malleus, that resembles a hammer. Its position lateral most ossicle that is attached to tympanic membrane. Its parts include head, neck, handle, and anterior and lateral processes. Head articulates with incus. Its neck is the constructed part below the head. Its handle is embedded in tympanic membrane, and its anterior and lateral processes project from the neck and help attach ligaments, as you can see in the diagram. Its function is to receive vibration from tympanic membrane and transmit them into incus. Second bone is incus that look like an inval. It is the middle ossicle, so it is present between malleus and stapes. Its parts include body, short process, long process, and lenticular process. Body is the part that articulates with the malleus head. Its short process anchor incus to the posterior wall of the middle ear. Its long process connect to the stapes, and its lenticular process is small knob at the end of long process that articulate with stapes. Its function is that it serves as a bridge transmitting sound from malleus to stapes. Third auditory ossicle is stapes that resemble a stirrup, that is the smallest bone in the body. It is the medial-most ossicle that fit into the oval window of the inner ear. Its parts include head, neck, cura, and footplate. Head articulates with the lenticular process of incus. Neck is the narrow part beneath the head. Cura is anterior and posterior. They are basically two curved limbs of the shapes. And footplate or base is the flat bottom that fits into the oval window, thus transferring vibration into perilymph of cochlea. Their function is to directly transmit mechanical sound vibration to inner ear fluid. Joints of ossicle. First is incudo-malleolar joint that is present between malleus and incus, and it is saddle-shaped synovial joint. Second joint is incudo-stapedial joint that is present between incus and stapes, and it is ball and socket synovial joint. Muscles of ossicles include: there are two tiny muscles that control ossicular movement and protect the inner ear from loud sounds. They include tensor tympani muscle that originate from pharyngotympanic tube and insert on malleus handle. It is innervated by mandibular nerve, that is branch of trigeminal nerve. Its function is to tense the tympanic membrane, thus reducing the vibration amplitude. Second muscle of ossicle is stapedius muscle, that is smallest skeletal muscle that is attached to the neck of stapes. It is innervated by facial nerve, that is seventh cranial nerve, and its function is to stabilize stapes and dampen excessive vibration. Ligaments of ossicles include anterior ligament of malleus that anchors malleus to anterior wall of tympanic cavity. Superior ligament of malleus that suspends malleus from roof of the cavity, and posterior ligament of the incus that stabilize incus. Functions of auditory ossicles. First function is sound transmission, as these ossicles conduct sound waves from tympanic membrane to oval window. Second function is amplification, as these ossicles act as a lever system to increase force of vibration. Third function is impedance matching, as these ossicles convert sound energy from air to fluid of the inner ear. that is low impedance energy to the high impedance energy. Fourth function is protection, as auditory ossicle muscle dampen movement in response to loud noise, protecting inner ear. Clinical significance. First is otosclerosis, that is abnormal bone growth around stapes foot plate that cause conductive hearing loss. Second is ossicular dislocation, that is trauma that can dislocate ossicles, thus impairing hearing. Third significance is congenital malformation, as developmental abnormalities may cause hearing defects. Fourth significance is chronic otitis media, that is middle ear infection that can erode ossicles, thus leading to hearing loss. Fifth significance is stapedius reflex loss, that is seen in facial nerve palsy that cause sound hypersensitivity. Conclusion of this lecture video. Auditory ossicles are a remarkable chain of bones that are designed for precise sound conduction and amplification. Despite their tiny size, they play an essential role in hearing, efficiently transferring sound energy from ear to the fluid of the inner ear while providing a protection against loud noises. Their understanding their anatomy is crucial for diagnosing and treating hearing related disorders. And this was about auditory ossicles. Hopefully you liked the video. If you do, don't forget to like, share, subscribe and comment. Thank you for watching.